Do you know where the profit is in your practice? Hi, everybody. Welcome to the KC CHIROpulse Podcast, brought to you by Katz Consultants and Chiro Health USA. We are your hosts, Dr. Troy Fox and Dr. Michael Perusich. So we're super happy you joined us today. Troy, here on our podcast, what do? We come up with cutting edge business strategies for chiropractors, not the old run your practice this way stuff, new, relevant, innovative strategies. So we're glad you're tuning in because we usually have a few jewels that you can start using today. Troy, do you know where the profit is in practice?
I absolutely do. And so write it down because here's one of the jewels right up front. Now, you got to be careful with this one. Don't let your friends know that you're doing this. What you do is every time you make a little bit of money, you put it in a mason jar and you dig a hole out and back behind your office. You put it in there. Just try to remember where you put it at. And over time, if everybody doesn't come in your backyard and steal all the mason jars, you're going to have at least $49.56 back there to use for whatever you want. So is that what you were asking? I mean, not that I've got mason jars in my backyard. Don't be going digging up a backyard, people.
Well, that's the camp spanking system, right?
I think that might be the old school way of trying to save a little bit of money back, right?
You know, and it's funny, the $49.56 you were talking about, you know, that's about what you get in reimbursement from the insurance companies over a year's time.
Yeah, exactly.
And here we are, we're chasing all this insurance stuff and like they're going to make us rich. And I'm sorry, insurance-based practices just don't make that kind of money anymore.
Dude,
don't throw stones at me.
You know what that's like? That's like, so wildcatters that went for oil back in the day and they got those big gushers that came out of the ground, right? And it was really cheap to get oil out of the ground and people made billions of dollars, right? And nowadays, what are we doing? We're fracking. We're going down and we're injecting stuff into shale to try that. That's what I feel like trying to get money out of insurance is like. We're fracking because it's very expensive, requires a lot of man hours. It requires a lot of focus. It can be done, right? Because you can do a cash or an insurance practice. It can be done, but oh my gosh, talk about spinning your wheels and really working hard for your money. Oh man, in comparison to running a cash practice, I think it is so much harder, so much more labor intensive, so much more drama inside of your practice. Because we all know the more staff you add, the more drama there is. Doesn't care if they're male or female. This isn't a sexist state. I've had male doctors in my practice when we've added that have changed the whole dynamic of the practice. And so male, female, anytime we add, so yeah, the whole thing is a disaster.
It is. And, you know, I was talking to a doctor the other day and he was talking about the fact that, oh my gosh, we're so busy. We can't keep up. And yet we have no profitability. And the first thing out of my mouth was, you're an insurance-based practice, aren't you?
Yeah.
Yeah. How'd you know? Because in an insurance practice, you're busy, but busy doesn't equal profitability.
Yeah.
So boys, you've got to realize that just because you're busy doesn't mean that you're striking it rich. You know, if insurance reimbursement actually made you profitable, then every in-network doctor out there would be filthy rich, and they're not.
No, when we look at your stats, the interesting thing is the gap between expenses and what you collected is like this in comparison to like this in a cash practice. I can look at your stats and tell you whether you're an insurance practice.
Oh, yeah.
The fact that you got that and the fact that you've got write-offs and you've got a bunch of AR sitting out there. Cash practice isn't going to have AR. And the gap in between profitability, in other words, what you collected and what your expenses are, is a lot wider gap in most cases.
Yeah. And you've got so many hidden costs when you're trying to chase insurance. You've got the billing person, you've got your, what's it called? The clearinghouse fees. And, you know, you've got all these extra money. Here's what we found in our practice. When we got to the point where we were 100% cash, not a lick of insurance anywhere, 100% cash, our expenses were down 34%. Think about that. Our expenses are down 34%. We went from seeing 2,000 patient visits a month to about 1,100. So I was working half as hard, half the number of patients, but we're 34% more profitable than smoke it. You know, when you get away from insurance, you begin to realize that the profitability is hidden in the cash side of your practice. That's where it's at. We got to take a quick break. So we're talking today about the illusion of profit in an insurance-based practice. I'm just going to be bold and call it that. So quick word from our sponsors and we'll be right back.
In today's economy, every dollar counts. Families are facing tough choices, having to reconsider what was once essential to them. But when it comes to healthcare, no one should have to compromise on their well-being because of financial constraints. That's where ChiroHealth USA steps in, the solution for your practice. We understand the financial pressures families are under, whether they're insured, on Medicare, or paying out of pocket for treatment. By offering discounts on care, you can ensure that your patients can still afford the treatment they need. At ChiroHealth USA, we're committed to making sure no family has to sacrifice their health due to financial hardship. We'll work with you to create a game plan that keeps your waiting room full and your practice thriving. And here's the best part. Offering affordable care not only benefits your patients, but also positively impacts your bottom line. So why wait? Join ChiroHealth USA today and join the ranks of the most successful practices. Because when you put your patients first, everyone wins.
All right, everybody, welcome back to the KC CHIROpulse Podcast. We're talking about where profit is hidden in your practice. And Troy, we just kind of let the cat out of the bag, right?
Yeah,
right
say that again, and then you got to finish that. Put that in your pipe and smoke it. So what did you say right before the break?
If insurance reimbursement made you profitable, then every in-network doctor would be filthy rich, and they're not.
And they're not. And they're struggling and they're giving up a lot. I remember looking at some of the clearinghouse fees, and I remember thinking, it's like paying credit card fees. It is so irritating to me to do all the work and have somebody else get paid for my work. That was part of the reason that drove me to cash as well, is because I got tired of paying other people for my work.
Absolutely.
It's like, dude, I do all the work and then I write you a check. How does that work? I'm beating my body up. Every one of you chiropractors out there that is doing services for patients is well, unless, I mean, even with activator though, because I mean, you tore yourself up over time. Activator eventually is going to wear you out. But if you're doing manual adjustments, I mean, you're giving your body up every day. I'm still manually adjusting. And guess what? I don't like giving my money to anybody else. I think I deserve every penny.
Every penny. And that's the great thing about the cash practice is you get to keep every single penny. And there's this crazy illusion that we've lived behind for years. And that's we've tried to hide behind insurance. We've tried to hide the financial conversation behind insurance. Oh, you've got Blue Cross, you've got great insurance. This is fantastic. You have a $20 copay. And yet that EOB comes back. And what's it say? You had to write off 70% of your services. You didn't get paid squat. And I can't tell you how many times I heard doctors talk about, oh yeah, some of that goes to patient responsibility, but we really don't want to talk to the patient about it. We don't want to make them think they owe more than their copay. So we just write that off. What? Why? You're already stuck in the quagmire of stagnant reimbursement. Why are you making it worse by writing off stuff that you should be collecting? None of that makes sense. We got to quit hiding behind insurance. Tell the patient what they're going to owe, be convicted about your treatment plan recommendations, and go full throttle into a profitable practice.
And I'm going to go off script just for a second on a little.
What if we ever had a script?
Yeah, exactly. We don't have a script, but so here's the other thing that I look at with as well. I believe, and I know I'm right about this because I have a t-shirt that says, I may be wrong, but I doubt it. I should have worn that today. Here's the other thing. Insurance delegitimizes chiropractic. And let me explain why. Delegitimizes chiropractic because here's what happens. You make an agreement with the patient that they need X number of visits over X number of time to achieve X percentage of improvement. And you and the patient do exactly as you said they were going to do. They improve, they're happy, you're happy, everybody's happy, your satisfaction is 90 some percent. Insurance company comes back and says, you overutilized.
Mhm.
What does that say about you as a person? What does that say to you about you to the patient at that point where the patient starts to question, did he really do me? Well, I liked what he did, but could he have done it in less visits? Could he have done it and not become an overutilizer based on my insurance policy? And so there's that question mark that gets put in the mind of patients with insurance in a lot of cases, unless we play by their rules, which we don't even know what their rules are. So we arbitrarily go, well, I'll just treat you a couple, 3 times and we'll kind of see how things go. Now, all of a sudden, you became the owie-practor instead of the chiropractor that you were supposed to be.
Yeah.
What you were doing. So I think it legitimizes you. And I think it devalues your service at that point, because all of a sudden, is it really worth what I thought it was? Because the insurance company doesn't see it that way.
Yeah. No, I think that's a great point. And, the EOB kind of wrecks our authority with our patients too. If you think about it, if a patient actually reads an EOB, which I realize probably very few do, and even fewer understand it, but it's designed for that. It's designed to be confusing. And so you submit a $60 office fee for an adjustment for a 98941. And what's the insurance company do? They discount it down to 35. So the patient sees that and goes, wow, Dr. Perusich is charging way too much for that. Thank goodness I've got my insurance to save me from that mean old doctor with those really high fees. Literally what they're seeing on that piece of paper.
Yeah.
And it's hurting you it's hurting your reputation. Couldn't get it out there.
Yeah.
And that confusion, whenever you build confusion into the patient conversation, whether it's verbally communicated or it's on a piece of paper or however it's presented, when you bring confusion in, what comes with confusion? Doubt. Now all of a sudden the patient's doubting, well, maybe I really don't need chiropractic care. I'm feeling better. Maybe that's good enough for now. This is why patients drop out so oftentimes. And what do you hear? You hear the financial complaint. Oh, I can't really afford things right now, blah, blah, blah. That's not what they're telling you. What they're telling you is, I got too much doubt about what care costs. Here's the great thing. On the cash side of your practice, there is no doubt. No EOB. It's a simple presentation of your fees. If you do it right, it makes you look really good. And all of a sudden, instead of waiting for 14 days or 90 days or whatever to get your reimbursement check, patient pays you every time they walk in the door. You get your money right now for all of your services that you did on that patient that day. You're not cut.
Right. And what's super cool about that, you're required by law to let the patients know what your charges are up front, right?
Yeah. It's called no surprises.
It's actually very helpful. So those of you that have resisted the No Surprises Act, we see it as an absolute boon, because it's a great way to lay out the charges in your practice in advance. And everybody go, you know what I hear all the time? Oh my gosh, that's so reasonable.
Yeah.
I love it. I love it. It's
we heard that all the time too. And yet we were the most expensive clinic in 7 counties. But people saw it as reasonable because they had nothing to compare it to. There's no EOB coming to their mailbox with an insurance company say, oh yeah, no, Dr. Fox is charging too much. It really should be down here. And so we got to get away from that. And Troy, you and I've said this for a long time. In the insurance world, chiropractic is a square peg in a round hole. We just don't fit well. And we were talking about the No Surprises Act being such a boon to the practice. You know what else I think has been a boon? And I'm going to get sticks and stones thrown at me for saying this, but medical necessity. So here's my theory on medical necessity. It gave us a sharp endpoint to the care that can be billed to the insurance company. And that's fantastic. Now, if you're trying to wait until the insurance theoretically runs out and then tell the patient, oh, now we're going to have you start paying out of pocket. You can't do it that way. There's a right communication strategy to make this work. And I'm not going to go into that today. But on the cash side of practice, one of the beautiful things about it is it's also where patients see the value. And so patients are coming in and investing in care. And what does the insurance company do? It gives the illusion that the insurance company is covering the cost of the investment. So it disassociates the patient from the responsibility of that investment. And so it's easy to quit. It's totally opposite of the way I think we've always thought, or maybe consumer mentality has changed over the years on how it works. But, we used to think that, oh my gosh, if they have insurance, they're going to want to use it because, it's going to save them a ton of money. The reverse of that is actually true. When they find value, here's the thing. Patients don't buy adjustments. They don't buy calendared appointments. What do they buy from you? They buy outcomes. They buy outcomes. And when they're attached to the investment aspect, the financial component, without the insurance middleman, now all of a sudden they find value in what you're doing. And this is where you create the lifetime patient. It's on the cash side of your practice. I mean, think about it. Where do you typically have the most insurance coverage? What kind of case? A PI case, right? But how many PI patients ever turn into lifetime patients? They don't. You know why? It's because they're 100% disassociated from the investment that's being made to restore their health. Somebody else is paying for it. And when somebody else stops paying, I'm done.
Yeah. I don't know how many times you've heard that. As long as the insurance keeps paying, I'm going to keep coming. And
Right.
that's usually with a PI, an injury case, a work comp case, something like that. When you get to the average person, it's like you said, medical necessity is one of our best friends, because what it really
It really
does is
is.
it disconnects us from that insurance. But if your patients don't understand it and you're not willing to explain it, it doesn't work well. Or if you try to, and I'm going to say this, and this will upset some people, but if you try to work the system, and unfortunately it's happened, and it's happened a lot, because people go, well, they paid for insurance, they deserve this care. Even though I know it's a maintenance visit, but if I mark down some things that they got taut tender fibers here and they're sore here and they're sore there, I ought to be able to make this thing fly. Right.
Yeah.
And you think you're not hurting anybody when you do that. But the truth of the matter is you're not the first person that's ever done that. And especially in the days of AI now, I mean, we've talked about this before. It's going to get seen. It's going to get noticed. You're not going to fly. Nobody flies under the radar anymore. Not one of us.
Not anymore.
The only people that fly under the radar are pure cash practices. And you're flying under the radar because you're offering a service. You're doing it for a specific price, and you've agreed with the patient. There's nothing wrong with that. That's a good thing. But you've made an agreement, and that's where the value comes into play. Patients engage. They know the pricing in advance. Because how many times do we tell a patient, they go, well, how much does it cost for an adjustment? A patient will ask that. Well, it depends on your insurance. I mean, how many times have we heard that? Yeah, man,
Right.
that's hard. That's hard when you tell people you can't even, I don't know what to tell you. I'm not sure how much our adjustments are, right?
That's funny. That reminds me, we had a staff person, a front desk person, and she hadn't been with us very long. And she came to Marissa and I one day and said, I'm really struggling talking about fees to patients, because this person over here on Blue Cross, they only have to pay $20.
Right.
And this person over here on Aetna has to pay $50. And all the patients are getting confused because they're hearing everybody's paying something different. And that's really what the insurance companies have kind of done to us. We're supposed to have a single fee schedule, and yet every insurance company drops their own fee schedule on you.
They're the ones that
I mean,
create the dual fee schedule, not us, right?
Yeah.
Yeah.
It's the nuttiest thing
It is.
ever. So we need to take a quick break. When we come back, we're talking about where profit's hidden in your practice. It's not really hidden. It's just on the cash side of your practice. You just got to recognize that
Right.
side of the practice is where you build profit. But when we come back, I want to talk a little bit about a couple of the different business models, business mindsets in the profession, and which one we believe you should be following. So, word from our sponsors. We'll be right back.
KC Chiropractic Consultants, your partner in chiropractic success. We are dedicated with one-on-one guidance to bring you all your practice management needs. Let's supercharge your practice. Give us a call today.
All right, Troy, we're back. We're back on the podcast, and we're talking about where profit is hidden in your practice. It's hidden in the cash side of the practice. But I want to talk about this. So we kind of see there's two basic models of business in our profession. There's the new patient-based model, where you're just driving new patients in all the time and hoping that enough kind of funnel out and stick around for a while. The other is the profit first model. And this is the model that we at CATS, this is the model that we believe in. We believe you should be a entrepreneur first. You should be the CEO of your practice first, and you should bow down as a provider to the insurance companies second, not the other way around. So when you build treatment plans, you've got to think about, how is this treatment plan going to turn profit? Okay. So when you build a treatment plan and you make treatment recommendations, you almost have to wear both your hats kind of at the same time. You have to wear your doctor hat. How am I going to get good outcomes for this patient? What's this patient need? Business hat. How am I going to drive profit? Now, unless you're a 501c3 and you're not trying to drive profit, which I don't think anybody out there is 501c3 listening to this, you're a for-profit business. So we need to put profit first in our business model. And this is one of the things that we look at really, really hard in doctors' statistics. We dig deep on this, and we've created some interesting models in our statistical analysis to really uncover how much profit you really have. And here's the scary thing. We see doctors all the time basically giving money away. And what am I talking about? Well, we'll see their profit literally is negative. When you strip everything away, when you quit looking at the new patient numbers, when you quit looking at the basic data like services and collections and those kind of things, which I'm not saying those aren't important. PVA, I'll get Troy riled up on that one.
100% on that one.
I'm not saying that some of those basic statistics aren't important, but they don't tell you anything about the profitability of your practice. So we strip everything away and we look really deep and find the profitability in your practice. And when you put profit first, you're really keeping an eye on your fee strategy. Is it working? You're keeping an eye on, what are the insurance companies making me write off? In other words, doctors, how often are you looking at those EOBs yourself and seeing what the notes are at the bottom of how they're either bundling you or making you write stuff off? Stop writing stuff off. Let's figure a different way. If it's a different code, if it needs to be a cash-based service and it becomes comfort care, not medically necessary care, you got to look at your overhead. You know, if your overhead's growing faster than your cash flow, we see this sometimes, but doctors aren't paying attention to it. They're looking at that new patient number. Oh, look, Martha, we had 45 new patients this month. That must be good. Tell me where that tells you anything about profit.
It's how
That new patient model.
it's how we were
broken.
taught for years and years and years as chiropractors. It's a broken business model. And when we talk about being an entrepreneur first, that's so important, because now all of a sudden you're not allowed, and I say this with meaning, you're not allowed to stick your head in the sand anymore. You are a business person first. So quit thinking it's a dirty word just to follow where the profit comes from. You are, like we talked about, you are not a not-for-profit business. You're a for-profit business. For-profit businesses don't bury their head in the sand and not look at where their profit's coming from, or if they're even making profit. That's how businesses go bankrupt. We've seen some of that just in recent days, just with policies within businesses. They make a bad decision and hurt themselves. But we as chiropractors have done it for years and years just by not even looking at the right numbers. It's like, oh, I don't really want to know how much I'm having to write off, because then it's going to upset me. Or I'm going to be bummed out when I read that number. Or I don't really want to know the differential between how much I collected and what my expenses were this month, because I really want to feel like that amount of money that's in my checking account right now is my money. When in reality, you may have $8,000 in the account because you just got a bolus of money from insurance payers, but yet you only netted 2,000 for the month. So if you burrow into that 8,000 and go, I'm going to go buy XYZ table, and you go buy that thing, now all of a sudden you're upside down and you're in trouble again. And you're like, what in the heck? Well, what in the heck is you have no idea what your statistics are saying. So with an entrepreneur-based model, you're not allowed to stick your head in the sand. You look at it, and I tell you what, in the end, you're going to be much happier because you will have a much stronger hold on your business. And that's why businesses do this. They want to know where they're headed. You can't drive a car down the road blindfolded, but you can, but it isn't going to turn out well.
Right. Yeah, you're right. The cash side of your practice is where so many good things reside. You know, that's where profitability is. That's where you actually have control over your profitability. It's the side of the practice that's predictable, because you can predict if you have a $40 adjustment fee, you can very easily predict that the patient that got that adjustment is going to walk up to the front desk and pay $40. It's predictable. You can predict it all day long. Your care plans tend to be a little bit better because now we're not trying to play the insurance game. Well, the insurance doesn't really cover this, or, you know, I'm going to have to write that off. So I just won't do it. The patient doesn't need it that bad. Your care plans become much more robust. And that means your finances become stronger. Your profit becomes bigger. And then you wrap all that up in the big ball of less stress. In Troy, you too, we hear from insurance-based doctors all the time, and they're so dang stressed out. Real world example, talking to one the other day, they're writing off 70% of their services, and their profit is going down. And I can tell you this, and I'm pretty sure I'm going to be right, that next year, this fall, next year, when the reimbursement schedules come out for all the insurance companies, what do you guys think out there? What do you docs out there think? Is reimbursement going to go up, or is it going to go down?
And I would conjecture involved with that, in addition to the enormous destructive amount of write-offs that you guys are getting, or caps on what you're able to get. The other thing that I look at with this is your time. How many of you are staying after hours because you're trying to meet a minimum requirement that the insurance company arbitrarily puts on you for documentation that is well above and beyond what a normal note should be, but yet you feel like you have to do it to continue to get paid. And so at 8:00 at night, you're still trying to write notes on those patients you saw today. Is that fair to you? Does that mean you're losing even more money because your time is valuable? Absolutely. So I see that as a detriment in the long term too. And I think quality of life improves as well when you become the owner of your practice, not the insurance company. Because right now, a lot of you, like we talked about earlier, you're putting the insurance companies first.
Yeah.
You're not putting patient and care plans first. You're putting insurance first. So when you do that, you're going to pay a hefty price in the long run. It just is what it is. And if you're willing to do that, so be it. But, you know.
And the other danger, and then we'll kind of jump out of here, but the other danger of an insurance-based practice is it puts you in a position where you don't want to raise your fees because you're just going to write off more.
Yeah.
And unfortunately, some in the profession seem to want to wear that as a badge of honor. I heard a doctor not too long ago at a conference talking about he hadn't raised his fees in 9 years. And wow, is he just a great guy in the community because he really held his fees down. Like, that's insane because all your expenses over the last 9 years have gone up. I guarantee you. You have to really be careful. So here's an exercise I want everybody to do this week. I want you to take a really hard look at your P&L. Now, some of you are probably saying, what is a P&L? That's your profit and loss statement. If you don't know what that is, talk to your accountant If you don't have an accountant, hopefully you have QuickBooks and you can get to the report section and print off your P&L. But take a look at it. Your profit and loss tells you what all your expenses are, tells you what all your revenue is and what all your expenses are. And I want you to just see if you can go through there and figure out even $500 in expenses that you can cut out. Cut the waste. This is a great time of year to do this. Cut the waste. And then figure out on the revenue side, how do we increase that by just 10%? Just 10%. So work on that this week. Run your practice like an entrepreneur, like you're the CEO of your own business. And let's quit hiding behind insurance reimbursement, because real profit is on the cash side of the practice. So go to katzconsultants.com if you haven't done so already. We've got a ton of downloads on there. All of our podcasts are on there. And by the way, thank you everybody for listening to us. Our podcast is growing like crazy, which is super exciting for us, because Troy and I just kind of do this because we like to get on our soapbox and rant and rave a little bit. But we appreciate everybody finding some kind of value in it. But so be sure to like and subscribe if you haven't already. Tune in every week and come check us out at katzconsultants.com. We're doing some great things for doctors' practices. And our strategies are very, very innovative, and they're very personalized to each individual practice. Troy, anything to add?
I think they need to go home and do that exercise, or well, you may already be at home listening to this. Do the exercise, because it really, little things like that. It's kind of like when your dad told you to save your spare change when you're a kid and put it into savings. It's the same type of thing. We're talking about little baby steps to make your practice improve. You don't have to do drastic changes. Most of you don't.
Right.
And so do that little step, do that exercise, look at your P&L, and then look at where can I increase my services or my collections by 10%? How cool would that be? Everybody wants 10% more.
Yeah. I mean, how great would that be? You know, if you're collecting $30,000 a month, 10% bumps you up to $33,000. I mean, that's an extra $36,000 a year. So it's well worth doing this exercise. All right, everybody, we're out of here. So thanks for tuning into the KC CHIROpulse Podcast, brought to you by Katz Consultants and Chiro Health USA. We will see all of you next time.
See ya.
There it is.